Across India, there is a growing concern over sudden cardiac arrest being reported even among seemingly healthy and active individuals. Before we tell you about the subtle signs that are ignored or brushed aside, here is the latest yet tragic case study from Meghalaya, where the sudden demise of Lok Sabha MP Ricky Andrew J. Singgon has shocked the state. The 54-year-old parliamentarian collapsed while playing futsal on the outskirts of Shillong and was later declared dead at hospital, reportedly due to the cardiac arrest. Tributes have poured in from across political spectrum. Prime Minister Narendra Modi remembered him as a committed public servant. Now, coming back to the issue, the warning signs always exist, but they are often ignored. The tragedy comes amid renewed focus on subtle health warnings that are often not taken care of. Cardiologists caution that even recurring leg cramps are not normal and may signal underlying circulation, nerve, or metabolic issues. They warn that the cramps triggered by walking and relieved by rest could indicate peripheral artery disease, while nighttime cramps and leg heaviness may point to venous insufficiency. Electrolyte imbalance, nerve disorders, medication, side effects, and other thyroid or vitamin deficiencies are also possible red flags. Now, body sends signals well before a serious cardiac or vascular event. Cardiac events don't always come with dramatic warnings. Sometimes they whisper through fatigue, cramps, or discomfort, which we choose to ignore. In an age where sudden cardiac arrests are rising even among the young and active, experts say listening early to these signals and seeking timely medical evaluation could make the difference between prevention and tragedy. On this issue, I am joined by Dr. Sanjeev Gera, Director and Head of the Interventional Cardiology, Fortis Hospital, and Dr. Vanita Arora, Cardiac Electrophysiologist and Interventional Cardiologist. Thank you, both of you, for joining me. Let me straight away first go to Dr. Gera. Dr. Gera, my question is very simple. Even if the fit heart collapses, does it mean that extreme exercise has limits in helping you to keep the heart fit? Can it have a detrimental impact on the heart?
Yeah, definitely. Some extreme exercise, when your heart is not actually accustomed or adapted to that exercise, it can be fatal, especially if someone is harboring silent heart disease. So what happens, around 50 to 60% of heart attack cases or cardiac arrest cases, they already have silent heart disease, which is actually missed. And maybe so many reasons are there. Maybe the symptoms were not very typical, or maybe they were not aware of those symptoms, or maybe they were not aware of their risk factors for having heart disease. And if they suddenly take some unaccustomed heavy exercise, the heart can...
I'll come to you. There's a bit of a technical problem in your line. Dr. Vanita Arora, am I audible to you, ma'am?
Yes, you are.
Okay, thank you so much. So my question is, why are fit people having cardiac arrests? And people associate some sort of a heart problem with pain. But these are like, killer movements. You suddenly collapse. Why is it happening?
So what you have to understand, the sudden cardiac arrest, the term that you are using, sudden, out of the blue, cardiac, it has to involve the heart. Arrest, heart has gone into a standstill. So it will come suddenly. It is not going to give us a prerequisite sign, and suddenly the heart will stop. And that is why these patients are collapsing, and you are not unable to, resuscitate them, or you are unable to save the life. There are always, as you said a little earlier, that there are always subtle signs. Every body gives subtle signs in case there is going to be a heart attack or there is going to be a sudden cardiac arrest. But those signs are ignored. But most of the time, sudden cardiac arrest, it occurs in young, healthy people, and it comes suddenly. So the most important point here is that we have to get our evaluation done. The evaluation in form of a cardiac checkup, that has to be done every year, and you have to see, not only get the evaluation done, you have to see a cardiologist with the reports and analyze that you are in the safer group and you are not up against sudden cardiac arrest. When we talk of sudden cardiac arrest, there are two primary causes of sudden cardiac arrest. One of them is coronary artery disease, which is like an epidemic in our country, which means there are blockages in the arteries of the heart and they have damaged the heart. There are scars in the heart which cause faster heartbeat coming from the lower chamber of the heart, which causes sudden cardiac arrest. The second reason are the hereditary cardiomyopathies. You must not even have heard the names which I am going to take, like hypertrophic cardiomyopathy, arrhythmogenic right ventricular dysplasia, like long QT syndrome, like Brugada syndrome. These are all hereditary, genetic mutations in the body which are occurring and which are causing faster heartbeat coming from the lower chamber of the heart, which makes the heart to collapse and a person to faint and have a cardiac arrest and die. These all can be evaluated by a simple investigation like an ECG. So ECG is available everywhere and anywhere in our country. We can get an ECG done even at a nursing home, at a clinic. Please get that done. Get a evaluation, cardiac evaluation done. I insist on the point that evaluation is required and a meeting a cardiologist is required to know whether you are up against sudden cardiac arrest or not.
Okay. How significant are continuous leg cramps, Dr. Gera?
Could you repeat the question?
How significant are consistent continuous leg cramps? Are they indicative of some heart problem?
Leg cramps, yeah. In some cases, when your heart is about to fail or when your pumping power is less, so maybe the leg muscles are not able to get enough blood when you start working or when you are walking. So that can be a sign of low heart function, or maybe some blockages in the leg artery. So that can also be a sign of having blockages in heart. So definitely, such cramps which earlier were not there, and certainly for last few months, anyone who is experiencing leg cramps on walking, especially, it is called intermittent claudication when flow is less. That can be actually a sign of low heart function or some blockages in the leg, which can actually correlate with some blockages in the heart also. It's a type of silent heart disease.
So, what are the signs? People get leg cramps, but what are the leg cramps associated with heart issues?
So, leg cramps are at rest. Actually, it is not heart disease, and heart disease is not directly related with leg cramps.
Okay.
So, when heart function is low, the heart is not able to pump enough blood to the leg veins or arteries. Then a patient can have cramps. But the cramps at rest can be because of so many things, electrolyte deficiency, nutritional deficiency, protein deficiency. But when we talk about heart disease leading to leg cramps, it is when you walk, you're not able to walk, and there is some pain. When you take rest, the pain is gone. So that can be a sign of atherosclerotic blockages or degenerative blockages. And around 50% of those patients who have blockages in the arteries of leg, they can have blockages in heart also. So it is basically an indirect sign that a patient can have blockages in the heart.
My second question to you, doctor, is that how does one get to know about plaque formation? How does one prevent plaque formation, and how does one get to know that the plaque formation in your body is higher than in a normal individual? Is there a test?
Yeah, so basically, when we talk about ECG only, ECG is just a myth actually. ECG can diagnose silent heart blocks in only 5% of cases, or if any patient who had some silent heart attack in the past, then ECG can actually tell you that there is heart attack or you have some, significant plaque in the arteries. But to detect a silent plaque, a simple stress test like treadmill test, stress echo, stress thallium, there are a few tests which can diagnose silent heart disease. But the irony is that even TMT and stress thallium is not positive unless the block is 70% or more in the heart arteries. So the best test to diagnose plaque deposition, especially if you have got risk factors like family history of heart disease or family history of early cardiac death, or maybe high cholesterol like familial hypercholesterolemia, when your cholesterol is more than 300, 400, then chances are high. High sugars, uncontrolled diabetes, HbA1c more than 7. And when you're obese, you're not working out, you are static, you are smoking. So if you have got those risk factors, then the chances of plaque deposition is very high. Then the only test which can diagnose silent plaques, it is a test called CT coronary angiography. And there is another marker which is called CT calcium score, which can be done even in kidney patient when there is no dye used in that test. CT calcium score is a very significant and very good marker to diagnose silent heart disease. So if the calcium score of your heart is more than 400, the probability of significant heart disease, significant blockages are very high.
So both of them, are they invasive, sir, or non-invasive?
No. This is not non-invasive. These are OPD-based, simple, non-invasive diagnostic tests.
OPD-based diagnostic steps.
Yes.
Dr. Arora, can I say that just walking 10,000 steps, having a healthy diet will keep you healthy. You know, does heart health requires more than just 10,000 steps every day?
See, for heart health, 40 minutes, 4 kilometers is enough. That is for the good cardiac health. You require to walk for 40 minutes, and 4 kilometers, if you are covering, that is good enough for you. Let's not confuse two issues here. You know, cardiac arrest, what you are talking about, the sudden cardiac arrest, is a problem of the electrical system of the heart. And coronary artery disease that you are saying, the blockages in the artery are the blood supply problem of the heart. So these two things are not same. Cardiac
Okay.
arrest and heart attack are not same. So let's not what happened with the patient that we are talking about is actually sudden cardiac arrest. That is the electrical short circuiting which occurs in the heart, that may or may not be, as I told you earlier, be related to any coronary artery disease. In case patient has had an MI in the past, has had a heart attack in the past, has had scar in the heart because of the heart attack, his heart function is less than 35%, then they
Why
can
does
have.
scarring takes place? Can you just please explain it to our viewers? What
Yeah,
is heart scarring?
once you, yeah, scarring can happen because of two reasons. One is because you have a heart attack. The blockages cause a heart attack, and that area becomes dead. If that area becomes dead, that becomes a scar. And this scar can get electrically generated. It can get electrically triggered to cause faster heartbeat coming from the lower chamber of the heart, which causes cardiac arrest. Second reason why scarring can occur in the heart is because of any kind of viral infection, like COVID. Like COVID, we had, whoever has had COVID has had some amount of myocarditis also. Myocarditis means inflammation of the muscles of the heart. And that inflammatory muscle process that does cause scar in the heart, leading on to faster heartbeat coming from the lower chamber of the heart. These are the two reasons why you can have scarring in the heart, very categorically.
Okay, and before I leave this discussion, Dr. Gera, you know, when people say that, you know, if you have to keep your heart healthy, you know, you really have to be on low-fat food, and you know, you can't take non-vegetarian food. Is it correct?
No, ideally, so we have some targets, okay? So if you want to avoid heart disease, so when we talk about general population, I'm not talking about diabetes or, you know, all those risk factors which we were discussing. So for a general healthy person, LDL cholesterol, which is a bad cholesterol, ideally should be less than 100. And when we talk about diabetic patient, our LDL cholesterol should be less than 70. So definitely our diet has to be, you know, very low in saturated fats. And we can have healthy fats, but when we you know, look at the total calories, proportion of fats giving total calories out of those calories, it should
Okay.
be not be more than 10 to 15% of total calories what we need per day. But in our Indian diet, you know, the fat is actually too high. Fat intake is too high, and
Even
then
the
carb
oil is
intake is
high.
too high.
Even the
Proteins
oil
are
is
less,
high.
fibers are less. So important is to keep your fat diet low, but definitely non-vegetarian diet intake is not related to heart disease. Yes, red meat sometimes if you take, you know, plenty of red meat every day, then someone can have heart disease or blockages, but it is not the only factor causing heart disease, because so many people across the world they eat actually red meat daily, but it is actually not correlated with that.
And Dr. Vanita Arora, last question to you. Do you think that genes are also a factor? You know, OTT platform did a very fabulous series called The Brown Heart. You know, are South Asians more susceptible?
To coronary artery disease, yes, we are more susceptible because we have smaller size coronary arteries. We end up having diffuse disease. We are the diabetic capital of the world, and diabetes is the most important risk factor for coronary artery disease. And genetically, we are more prone to coronary artery disease. Yes, that's correct. That's not a myth. That's a fact.
Okay, thank you. Thank you both of you for joining me. I think it was very enlightening to have you both on board. Even leg cramps, if they continuously happen, I think you should visit your doctor.